Resuscitation and AED. Cardiopulmonary resuscitation, or CPR, is an emergency procedure that is attempted in an effort to return life to a person who is not breathing normally, as well as to keep the vital organs fed with oxygenated blood and in particular our brain. This procedure combines chest compressions with rescue breaths. The chest compressions replaces the heart's ability to pump oxygenated blood around the body, particularly the vital organs. Rescue breathing provides the casualty, who is unable to breathe normally, valuable oxygen, which is transported around the body by the chest compressions. Without oxygen, brain damage can occur within 3 minutes, therefore your immediate action is paramount. Your immediate action now is to contact the emergency services and to ask for an ambulance, ensuring you state clearly that your casualty is not breathing normally. If you have a bystander, then ask them to make this call. If not, you must make this call yourself. If you are able to, activate the speaker function on your phone to aid communication between you and the emergency services. Commence CPR without delay. Start with 30 chest compressions. Kneel by the side of your casualty. Place the heel of one hand in the center of the casualty's chest. Place the heel of your other hand on top of the other. If possible, interlock your hands. Do not apply any pressure over the upper abdomen. Position yourself vertically above their chest and, with your arms straight, press down on the chest at least 5 centimeters, but not more than 6. After each compression, release all the pressure on the chest without losing contact between your hands and their chest. Repeat the compression 30 times at a rate of 100 to 120 compressions per minute. Compression and release should take an equal amount of time. In most circumstances, it will be possible to identify the correct hand position for chest compressions without removing the casualty's clothes. However, if you are in any doubt, then you can remove outer clothing. After 30 chest compressions, open the airway using the head tilt and chin lift method and give 2 rescue breaths. Pinch the soft part of their nose closed, using the index finger and thumb of your hand that supports their forehead. Allow their mouth to open, but maintain the chin lift. Take a normal breath and place your lips around their mouth, making sure that you have a good seal. Blow steadily into their mouth whilst watching for their chest to rise. Maintaining head tilt and chin lift, take your mouth away from theirs and watch for their chest to fall. Take another normal breath and blow into their mouth once more to give a total of 2 effective rescue breaths. Do not interrupt compressions by more than 10 seconds to deliver both breaths. If the initial rescue breath of each sequence does not make the chest rise as in normal breathing, then, before your next attempt, check the casualty's mouth and remove any visible obstruction. Check that there is adequate head tilt and chin lift. Do not attempt more than 2 breaths each time before returning to chest compression. In order to reduce the risk of cross-contamination when giving rescue breaths, there are various protective shields and masks available that will significantly reduce this risk. Repeat 30 compressions and 2 breaths until a health professional tells you to stop, the casualty is definitely waking up, moving, opening their eyes and breathing normally for themselves again, or you become exhausted and are unable to continue. It must be emphasised that if you are unable to give rescue breaths for whatever reason, then you must continue with chest compression only CPR. If there is more than one rescuer present, another should take over CPR about every 1 to 2 minutes to prevent fatigue. Ensure the minimum of delay during the changeover of rescuers, and do not interrupt chest compressions. If you have access to an automated external defibrillator or AED as soon as it arrives, switch it on and attach the electrode pads onto the casualty's chest as shown on the packaging. If more than one rescuer is present, CPR should be continued whilst the electrode pads are being attached to the chest. Switch the AED on and follow the voice prompts. You must ensure that there is no contact with the casualty from anyone, including yourself, unless you are prompted by the AED to continue with CPR. Introduction to the defibrillator. Coronary and heart disease, CHD, is the UK's biggest killer. Approximately 86,000 people die of a heart attack each year, which means that approximately every 6 minutes of every day, someone will die of a heart attack. When someone goes into cardiac arrest, the heart will initially continue to beat, but in an uncoordinated, abnormal way. This severely abnormal, chaotic heart rhythm, arrhythmia, is known as ventricular fibrillation, or VF. When suffering from VF, the heart is no longer able to pump blood to our most vital of organs, the brain, as well as other vital organs such as the lungs. As a result of this, oxygen is not being transported from the lungs back to the heart, nor is it being transported around the body. Death will occur in minutes if the heart's normal rhythm is not restored. The most common cause of VF is a heart attack. However, VF can occur whenever the heart does not get enough oxygen, or if someone has other heart disorders. A casualty who has a VF episode will suddenly collapse or become unconscious because the brain and muscles have stopped receiving blood from the heart. The casualty's only chance of survival is with immediate treatment. CPR could be enough for a small percentage of casualties. However, the chances of survival increase dramatically with a controlled electric shock from a defibrillator. Automated external defibrillators, AEDs, will only shock the casualty if VF is present, or if its precursor is present, ventricular tachycardia, which results in a very rapid heartbeat. For each minute that defibrillation is delayed, the chances of your casualty recovering is reduced by 10%. Therefore, after about 10 minutes, your casualty will have little chance of surviving, hence the importance of having an AED accessible to you. In the past, defibrillation was only ever offered by professional medical personnel. Over recent years, this has changed with the development of AEDs. This means that with some basic training, we can all use it, because it is automated. The chain of survival. It is critical that you follow the chain of survival when you're dealing with a casualty who is not breathing normally. Early recognition and call for help. If you are able to recognise those at risk of cardiac arrest and call for help immediately, the hope is that early treatment can prevent arrest. Early CPR. You must start CPR to buy time until medical help arrives. If you don't start CPR immediately, then oxygenated blood will never reach the vital organs, and your casualty will have little or no chance of survival. Early defibrillation. Defibrillators give an electric shock to reorganise the rhythm of the heart. Defibrillation within 3 to 5 minutes of cardiac arrest can produce survival rates as high as 50 to 70%. Each minute of delay without defibrillation reduces the probability of survival to hospital discharge by 10%. As soon as the AED arrives, connect it to your casualty and follow the voice prompts. And finally, post-resuscitation care. Professional help will help restore the quality of life. Potential life-saving equipment and drugs that are carried by the emergency services will further enhance the chance of survival. Please remember that if you don't make this call from the outset, the emergency services will never arrive.